Thank you so much for the invitation. We'll start with our first speaker of this session, Dr. Zahid Almandhari, who is a consultant radiation oncologist at Sultan Qaboos Comprehensive Cancer Center. He will talk about AI and radiotherapy transforming cancer care.
Thank you very much. So I'm going to be talking to you about AI and radiotherapy transforming cancer care, in particular in GI, is what I was asked to discuss. So I have nothing to disclose. So what we're going to do today, we'll talk about AI and oncology radiotherapy in general. I'll talk about complexity of the workflow and we'll explore how AI can actually help. And we'll talk about the challenges and the future directions. So we've heard a lot about the estimated burden of cancer, which is going to be increasing significantly in our region. And the thing is that 70% of this increase that will be seen in the world will actually be happening in the low and middle income countries, particularly in the MENA region. And radiotherapy is definitely a core modality of treatment, especially in our region because of the more advanced cancers. So more than 50% of patients actually require radiotherapy treatment. Most common cancer in the countries that don't have smoking issue is breast and prostate. Countries where they have smoking, lung cancer takes precedence. And RT radiotherapy access in the MENA region ranges from 10 to 50%. So we have rich countries, we have poor countries, and it varies significantly. This produces long waiting times, disease progression, poor survival, etc. And shortage of radiotherapy workflows is a major component. And we've heard that in a lot of the talks since this conference started. And radiotherapy is a labor-intensive workflow. So what do us radiation oncologists, radiotherapists, medical physicists, what do we expect AI to do for us? So this is a nice study that was published in 2020, asking the same question. Most people want this to improve work output and productivity, 88%, quality of planning, not much change there, but consistency of planning was a major ask, 90%. Staff focus on patients so we can have more time to be with our patients, that was 49%. Decreasing systematic errors was 40%, and decreasing random and human errors was 74%. So these are things that is our wish list of what AI can do for our specialty. And we know radiotherapy workflow is very complex, starting from treatment decision to when you follow up, the many steps in it. And if we look at the output of radiotherapy AI in the recent years, it's been a massive increase of publications. But the thing is that most of these publications are from two places, China and the US. We need more from our region. We need to look at what we can do for our patients. So let's go over the patient journey and see how AI can actually help these patients. So first of all, when we talk about treatment decision, AI tools can be integrated in clinical data such as patient history. I'll talk about some of the things that we've actually used in the hospital that have really impacted us. So for example, in our MDT meetings, we have doctors who come in and they talk about, radiologists, pathologists, medical oncologists, surgeons, radiation oncologists, and we all sit together and we discuss. And we have a very high KPI in our hospital of more than 99% of our patients go through an MDT. Actually, we're achieving 100%. No patient is actually seen without having an MDT discussion. So, but these discussions take time, and there's lots of if you've been in the Middle East, you know that people will walk in, Assalamu alaikum, people will walk in out, there'll be talks, there'll be side talks, there'll be lots of discussions, and someone will be trying to capture the notes and concentrate on this. So we've actually used an AI tool that listens through the meeting. It is HIPAA compliant, GDRP compliant, SOC 21 compliant. So it's compliant with all the confidentiality clauses. So what it does is it just removes all of these side talks, organizes our patient list very well. You have a very good summary telling you what the patient is, tells you what the clinical issues are, tells you what the radiologist said, what the pathologist said. what the plan of action is, and even make suggestions for you. This has cut our time in terms of documenting MDT significantly. So it's just one tool that has helped us a lot in our center. Then we talk about simulation. Simulation AI obviously improves, has a lot of potential, from respiratory motion management to auto segmentation, treatment planning, as mentioned. Quality assurance is an important tool, and I'll talk about that also as we go through. And then radiotherapy delivery and follow-up. So we'll talk about some of the examples we've done in Oman. One is this breast cancer imaging, so early diagnosis of breast cancer. Very easy tool. But what I wanted to take a message is that these are all slides from the company. And we validated this. And this is actually our results. You can see this. We did actually get similar results. And anytime you take an AI tool that you want to use in your environment and you take it from a different environment, you have to validate and make sure that it actually works for you. So our results were very good. Accuracy was 94%, sensitivity was 78%, and specificity was 95%. Which is actually in keeping with what, and why did we use this AI tool? You've seen the graphs before when we're talking about the region, we talk about the number of radiologists that we have. And when we talk about mammograms, you need two people to look at those mammograms. So either two physicians, or what we decided is AI plus a physician. So when we talk about auto-segmentation, everybody knows about auto-segmentation. And the time that we spend in correcting auto-segmentation is because, oh, no, this needs to be wider. This needs to be bigger. But what I wanted to share with you is actually this paper, very useful paper that was published in 2022 about lung cancer. This AI tool showed that when it comes to contouring, we think the AI is underestimating. But when it comes to lung cancer, we tend to underestimate. We tend to be cautious. We tend to drop down the dose. When we compare to clinical trials that have actually been out there, radiation oncologists tend to underdose our patients. So this tool actually shows you that, gives you an AI guidance to what is the correct dose for the site and so on. And even today, during the discussion for SBRT lung, you had the question, if it is this, if it is that. So people tend to be overcautious. This AI tool can help. So what are the challenges when it comes to GI cancers? Obviously, GI cancers have a couple of things that are going for them. One, mobility. We can't stop our intestines from moving, but that's not the end of it. Obviously, there's breathing also attached to that. Then, obviously, the second thing is radiosensitivity. GI organs are very radiosensitive. And the third thing is the treatment trade-offs that we need to make when it comes to these treatments. So understanding adaptive radiotherapy is what really would help. And when it comes to adaptive radiotherapy, it is very time-consuming. And if you're asking someone to recontour every single day, so you can monitor or recontour a tumor that's moving, that's going to be time-consuming. So AI actually can revolutionize this by simplifying the adaptive radiotherapy workflow. So from auto-segmentation to improved delineation, etc. And there are multiple models for segmentation. And it's good to know this because each model has its strengths and weaknesses. And if you're not used auto-segmentation before, you can even test it out. You can download 3D Slicer and play around with it. You can try Total Segmentator, very interesting tool. We'll contour everything on that CT from head to toe. But another useful tool in AI is actually contouring with PET. I mean, you know that with PET scan, you can actually change the window and level, and your volume will actually change significantly, as you can actually see in this diagram at the bottom. When you use AI, it actually identifies where this cutoff point is. It doesn't matter what the window and level is, and you can actually identify the area that you need to contour. Very, very useful. And PET is coming in. Adaptive radiotherapy is coming in. We're using gadolinium-62 dotatate scans for meningioma, and it helps us to identify areas. And we've done a study comparing MRI only, MRI and the PETs. And this makes a huge difference in identifying the area that you need to adjust the volume in order to cover your meningioma well. So it's not just seeing, but how do you actually contour once you see that area? A useful tool using AI. And there are a number of, for head and neck, obviously, that's where most people don't like to work in head and neck because of the amount of contouring that you need to do. And AI has consistently shown that that it can actually help in this contouring. This paper was published in 2023. Consistency in contouring of organs at risk by artificial intelligence versus oncologists in head and neck cancers. Another aspect that I think is important to know about is MRI distortion. So we're using multimodalities in contouring tumors, especially now when we're starting to target smaller and smaller lesions in the brain, etc., with SBRT, with CyberKnife. And this has to be in your mind. MRI distortion is an important aspect, especially if you're imaging with 3 Tesla. And the radiologists don't need to know, don't care about the distortion when we actually care. So in the console of an MRI, whether if you're using a diagnostic MRI or you're using a simulation MRI, this is an optional thing that you can activate. One is correction of MRI distortion. This correction, make sure it's turned on in your center for the radiology department so that what the coordinates that you see actually identify the correct position of these lesions. That's point number 1. Point number 2, this correction is a general correction. It's not AI-based. It's just, look, it takes into consideration what's a phantom and gives you the corrections for it. But there are tools that are AI-driven that can correct for this distortion, looking at the CT and looking at the patient's image, and can actually correct for distortions of the MRI. And one of the tools is provided by BrainLab. MRCAT, very useful tool if you want to eliminate CT completely in your workflow, go only with the MRI. And AI in treatment planning, as I mentioned, knowledge-based planning is actually reducing time and also reducing errors. So you can have a plan and the radiologist can look, a radiation oncologist can look at it and says, oh, this looks like a good plan. Knowledge-based will tell you, well, it may be a good plan, but in general, the dose to your bowel is actually higher than what is normally seen in this type of plans. So then you get highlights and you say, okay, maybe I need to work better in improving the dose to the bowel for this particular plan. Knowledge-based planning, beautiful. Just simple checks tells you you're within the limits, you're well within the limits, or this seems to be an issue that you need to look into. Then AI-driven quality assurance. This is actually a very important tool that can help decrease the time from when, especially for example, now it's mandated in many countries to do patient-specific QA in France, etc. For our center, we do it for all patients. But you can imagine the time consumption that we go to the machine, we put in the film, and we do the patient-specific dosimetry, and then, oh, it failed. Imagine an AI tool that can actually give you a prediction that this actually is going to fail, and then you fix it, and it tells you it's going to pass, and then you go and do your work, and it passes. So how much time did that actually save in terms of going to an actual plan and getting the patients treated? So this is something that actually exists and you can utilize. So how much time does it help when you introduce machine learning and AI? So on average, you're looking at a reduction of about 60% increase of efficiency using a machine learning and AI. In this particular paper, this was published in 2022, went from hours, days to minutes, seconds, and minutes. This is a bit on the extreme side, but anyway. Radiomics is another area that's actually coming up, and we need to be well-versed in radiomics because it will help us to go into the era of adaptive and biologically adaptive radiotherapy. Very important tool that is powered by machine learning. Motion management, as I mentioned, is something that you might think that you're using it every day, but it is actually machine learning based, where it predicts where the tumor is going to be based on the previous images and what the breathing pattern of the patient is. And we see that in CyberKnife, in surface-guided radiotherapy with Vision RT. And this is the example I was mentioning to you about the quality assurance radiotherapy. So you have the predicted plan, and you have the actual image. So you can see that the AI can actually predict what is going to pass and what is not going to pass. In MR-Linac, I don't need to talk about that. Someone's going to talk a lot in the next talks, I think. So what are the challenges and ethical considerations? I think major challenge is data privacy and security. If you do not have your hospital or institution already implemented a natural language, AI. Doctors, therapists, students are going to start using other tools that are freely available. We'll start using ChatGPT, and you cannot upload health information in ChatGPT and think that you're going to get away with it. You need, the only way to fix that is having institutionalized tools that are HIPAA compliant, that can protect patient confidentiality, and you can use it safely within the hospital environment. Also, breaches of data is really a risk, especially in our day and era. And many people are using this. You take an image of a note and ask ChatGPT. Don't do that. And there are regulatory hurdles that we need to overcome when it comes to AI. Major hurdle is that we don't trust AI, especially because AI makes mistakes. So who's in charge? Who is responsible for the AI? And it's an ethical question. You know, we teach medical students, and medical students graduates and makes a mistake. Was it the teacher who taught the medical student that made a mistake? Was it the medical student who made the mistake? But AI is taught to mimic humans, and to be human is to err. And if AI is mimicking a human, it will err at any stage in time. So who's responsible? So that's a major regulatory hurdle that we need to overcome, because we're not used to calculators making mistakes. 1 + 1 = 2 always. And then the need for validation and explanation. As I said, you need to validate, not just take an AI and adapt it in your environment, especially in this day and age. There's so many AIs out there. Adopting it for your environment, you might get engaged or locked into one technology that might not be useful for you, and then you're just wasting money. Clinical workflow integration is mandatory. If you can find an AI that can actually work for you, and you look at your workflow, and those areas are the areas that you really need to focus on, because if you can improve your workflow, that's a major gain. And then challenges in real world settings, as I mentioned again, if you don't do anything in the hospital, people are going to find ways of using other tools. Bias and other challenges are well known in AI, so we won't go into that. So what's the future? I mean, we have tested a number of AI tools in our hospital. One of them is auto planning also, which at the moment is not there. But I think AI-driven, fully autonomous treatment planning is coming. AI-enhanced radiogenomics for precision oncology, something that includes وش كان الكلمة هذه؟ After food now. Radiomics, metabolomics, genomics, patient's history, everything coming together. And that gives you the precision oncology. That's what's coming. Quantum computing is really going to accelerate this significantly. And then multimodal AI integration, genomics, pathology, and imaging will be the future of AI. So AI is revolutionizing radiotherapy with increased accuracy and efficiency, addressing challenges. Will widespread this adoption, and the future developments are promising. And we hope the best for the future, but be cautious. Thank you.
Thank you so much, Dr. Zahid, for this eye-opening talk. Probably we'll have a couple of questions. If no one, I can kick off this.
I actually have the tool that we use in the MDT with me here. Beautiful tool. We've never used it. This is a time saver.
So I was about to ask you, what in real life are you using? What tool are you using in real life?
Yeah, so there are two. In MDT, as I said, we're using this tool. Beautiful. You just keep it on the table. It does, it removes all these side notes. Everything is out. So you expect, transcription. It will have all salamu alaikum. How are you doing? What should we do next week? And all that is removed. You only get the patient's notes, and it really gives you a good summary. So patient so and so and so, T2, N1, M0, adenocarcinoma, this is this. And so it gives you a summary of what was discussed. Then it gives you what the radiology findings were, pathology findings were, nice summarized. Everything is summarized. Our challenge was that our MDT was a day before the clinic, and it's at the end of the day. So we don't have time to actually put the notes in before we go see the patients the next day. We always had that challenge. We had to remember what did we decide in the MDT. This was a game changer for us. We also have the same HIPAA GRP compliant tool that we use also when we patient encounter. So you wear the device, you walk in and you speak English, Arabic, Baluchi, Swahili, whatever language, Urdu, and you talk to the patient, explain everything to them, you come out, and it gives you a SOP note immediately. Subjective, objective assessment and plan, done. Major time saver.
Excuse me, Zahid, I just would like to ask you how you think it will affect the new generation, especially the resident that in training and those recently graduated that need to build their experience. Because just with one click, they get auto segmentation, they get recommendation for planning, they get recommendation for treatment. We have like 10 or 12 residents currently in training, and we've tried the AI for 3 months, and we thought there will be some, it will affect their training, I think, on the long term.
I think the training part is a big challenge for everyone, not just the medical side. Even in colleges and universities, I mean, you've seen a lot of videos of professors screaming and shouting, "Don't use ChatGPT." But how do we? I think at some stage we have to learn how to utilize and work with the technology. It's the same as calculators that when it first was invented. I remember when I was much younger, you're not allowed to take a calculator to school. Now it's mandatory before the exam to have a calculator with you. So at some stage, AI is going to play a role as a companion for our students, and we just have to know how do we adopt and adapt to it. It's here, and we just have to learn how to work with it.
I think for the sake of time, we'll conclude the talk, and we can have the questions.